610 WTVN.
Interesting guest coming your way right now, cardiologist Dr. Fahmi Farah. Doctor, we so appreciate the time and the comment this morning.
Thank you. I'm glad to be here. It's an honor.
Thank you.
Thank you very much.
Absolutely. So there's an awful lot of questions around COVID-19, and one of them, which really seemed to be brought to a head by college football, is this attacking of the heart. If you just do a quick Google search, which anymore it seems, Doctor, a lot of people just do to try to get their feet under them, what I read as a result of that is that cardiac problems, heart issues as a result of COVID, often brought on by people that are having severe cases of COVID. It's not an all-the-time thing, and that's what makes it problematic from my perspective. Would you agree with that? Because it's not an every case of COVID brings on heart problems, it makes it harder to talk about it and figure out and really make great decisions based on kind of sporadic amounts of dealing with it?
Oh, absolutely. I definitely think that because the symptoms are so variable from individual to individual and that it's not occurring in every individual, it makes it all the more challenging to talk about it. Also, there's just so much information out there, and you just don't know which one is accurate.
So from your perspective, who is it that you trust? When doing your job as a cardiologist, who are the resources that you look to for the best information about COVID and heart problems?
There are several resources out there for us physicians. We are very much guideline-driven. We follow the CDC guidelines. We follow the World Health Organization guidelines. But as far as heart goes specifically, we follow our colleges. For instance, the American College of Cardiology, their guidelines, the European Society of Cardiology, and the American Heart Association. Those three are our primary go-to. They're the ones who, kind of guide us as to what's going on. We pay attention to the studies and the research that's being done and, the new data and information that we are receiving regarding heart disease related to COVID. And there's one specific thing I wanted to speak about today, which was myocarditis. There are many things that can happen as a result of COVID. We are seeing more and more people who are being affected from a heart standpoint, meaning their heart is getting affected as a result of COVID. Myocarditis, it is one of the ways the virus is attacking the heart.
Can you tell me exactly what is myocarditis?
Yes, myocarditis is an inflammation of the myocardium, which is the heart muscle. It can happen to anyone at any age, and there are various causes for myocarditis. The most well-known cause is viral illness. So other types of viral illnesses can lead to myocarditis, and we're seeing a lot of patients who are battling COVID-19, even those who have recovered from COVID-19, coming up with myocarditis. Many people who are infected with COVID with symptoms ranging from severe to completely asymptomatic are being diagnosed with myocarditis even after recovering from the infection itself. And it is happening to young people as well.
See, that's the issue. And we're in the heart of Big Ten country here. We're not playing football this year, at least not at this point. That discussion is ongoing. And I feel like when you look at the timeline of decisions made, myocarditis had a big part of not playing football this year because there was a player, I think it was in Illinois, got COVID, a severe case over the summer, developed myocarditis, and there was this idea that it could really impact a fairly decent percentage, potentially, of players, and that's what prompted the decision. So is there any guidance now as far as what your likelihood is if you succumb to COVID? How likely are you also to succumb to myocarditis?
Yes, we do have some data For example, there was a study that was conducted. It was an European study in Germany, which showed that they had a cardiac MRI done on some of their COVID patients, and it revealed roughly 22% of their patients showed inflammation of the heart muscle and new scar formation of the heart. So there's one. And then in America, we had two recent studies published in JAMA. One was results of autopsy done on 39 COVID-19 patients, and it showed inflammation of the heart muscle who did not exhibit any cardiac symptoms before they succumbed completely. And then we had another study, a second study, that used cardiac MRI on 100 patients that showed inflammation in 78% and ongoing inflammation of the heart muscle in 60%. And these patients had very mild to no symptoms while they're infected with COVID.
Wow.
So we do have some pretty compelling data that the heart muscle is being affected in many, many COVID patients. Now, this is not particularly data I just mentioned. It's not, specific to athletes.
Okay.
It's for everybody. But we know from the Big Ten and other organizations that athletes are being affected, and proper precautions should be taken. So I think this is a good opportunity to talk about myocarditis so that people understand what it is, and that just because you're not symptomatic does not mean that you do not have myocarditis.
Cardiologist Dr. Fahmi Farah, our guest. We're talking myocarditis, we're talking COVID, and where we are in the pandemic. So as a cardiologist, is this something that you've had to deal with in your practice, people that have succumbed to COVID and then start having these heart issues?
Yes. So initially, like at the beginning of the pandemic and in the middle of the pandemic, when we're seeing a big surge in the hospital side, so inpatient, hospitalized patients who are very sick, we were seeing a lot of myocarditis at that time, and the patients were very sick with, cardiac issues as well. But now that, we're seeing a lot of the patients as outpatients, these are patients who have recovered from COVID. Interestingly, we are seeing a lot of these patients who have recovered come to clinic with cardiac problems. And a lot of these are young people, and they never had any cardiac problems prior to this.
Yeah.
So we're most commonly seeing the presentation of myocarditis actually a few weeks after being infected with COVID. And the most common symptoms of myocarditis that people should know about are chest pain, shortness of breath, fatigue, palpitations, things like these.
And do you, in your practice, that 22% number that you mentioned earlier, does that seem to kind of parallel what you're seeing in your own practice?
I would say so, yes. We are seeing quite a bit of patients, particularly young people, who are being diagnosed with myocarditis as a result of this. So I don't have an exact number,
right.
Because we simply don't have that yet. But yes, we are seeing roughly in that range.
Okay, and then from your experience, doctor, is this a thing? The COVID kind of exacerbates the problem, or is it someone that generally is heart healthy as a result of COVID now has heart problems?
It's the second one. It could happen to somebody who has no prior history of heart disease, and as a result of COVID, this is an inflammation that's taking place within the heart. It's a new diagnosis.
It's, it really gets you. I mean, you think about there are some people that have reluctance to follow any of the protocols, and then you hear basically 1 in 5 people, if you contract COVID, you then might also have this myocarditis, which, I mean, your very being is affected because the heart is arguably the most important organ. So what would you say to people as far as following protocol and moving forward and trying to be as healthy as possible? Is it follow all the protocols? And I mean, is there any medications or vitamins or anything that you can take to kind of beef your heart up so even if you get COVID, maybe you're not impacted on this level?
I don't believe that there's any way to prevent myocarditis. There's not really any medicine that you can take to prevent this from happening. If your immune system is better, hopefully your chances of contracting this is a little bit less. But no, not really. Even healthy people who have perfect immune health are being affected with myocarditis. And actually the reason it is very important to diagnose and treat myocarditis is because if not treated appropriately in a timely manner, it can cause serious complications and can even be fatal. Myocarditis is, again, inflammation of the heart muscle, which can lead to three very serious conditions. One is heart failure, which is because the inflammation causes the heart muscle to weaken and reduce the heart's ability to pump, reducing heart function and causing the patient to go into heart failure. Second is cardiac arrhythmia. This is the one that we really care about, especially for athletes. The inflammation can cause the heart to have erratic rhythm, specifically ventricular arrhythmia, such as ventricular tachycardia or ventricular fibrillation that can cause cardiac arrest. And third is cardiac tamponade. It's a condition that's caused by the inflammation, causing the heart muscle to become leaky and cause fluid to build up in the pericardial space, which is it's a space between the heart and the sac the heart is encased with. And this can lead to dangerous hemodynamic compromise and can be fatal.
Yeah.